Since I started working at Catherine's, it's been really powerful for me to see what kind of patients we're serving. A lot of them are the working poor, and they're really striving hard to do more, and they need help, they need resources, and it's been pretty awesome to see how we meet those. For example, Sharon was in so much pain she couldn't get out of bed, let alone keep her job working as a janitor. And it was hard for her to even come in to the clinic to get care. She was in so much pain.
I'll never forget the day when I fell. I did not think I'd ever walk again or even be able to do anything for myself because it was so painful. I couldn't sleep, couldn't hardly walk. I didn't have an appetite. I lost a lot of weight. My sugar was way off. My blood pressure was high. I was just lost. I had no idea what was going to happen to me. I had no money coming in. I had no health insurance. I had absolutely nothing, and I was terrified. And I was taken care of. They put me on pain medicine. I had to have little needles they put in my ears to help with the pain. And that really helped me. And then they sent me to therapy, Mary Freebed, and they got me walking again. And they just put me on the right track of where to go and have built up my health. And if it wasn't for the Catherine's Health Center, I would be very ill. And if you guys weren't here, who knows where I'd be? Who knows where I'd be? You're a blessing, all of you.
So many of our patients coming through these doors, once they're here, still have so many needs. They need medications that they can't afford. They need referrals to specialists like surgeons or mental health specialists. And they don't have access to any of those, and they don't know how to get plugged into any of those services. And Moody's a really good example of that. When I met him, he had metabolic disease completely out of control. His diabetes and his blood pressure and cholesterol all were doing permanent damage to him. And because of our medication assistance program and some of the free samples we had, we were able to stop the bleeding because he was just broken.
The thing is the medicines they help me with here. That's the biggest thing. I'm telling you, if it wasn't for them helping me get my medicines, I don't think I would have made it. I don't think I would have made it. Because if they can't get my insulin, and they can't get my pills, I would be lost. I don't think I would be able to make it long. I can't do what I used to do. I worked in asphalt 35 years. I could not take the heat anymore. I was getting dizzy on my machine. I was throwing up. It's not fun. It's not something that you want to do. You know, you're out there with a bunch of construction guys, and you get overheated, you start sweating a lot, then you get blurry, and you have to run off the machine and throw up. And it just ain't gonna work, because you can't stop. So at 62, I went and retired. I lived from month to month. I went from making a little over $1,000 a week to $1,400 a month. Now you take and live on that, and it's hard to do. It's not much to live on. I struggle. And without this, I don't know. I mean, like I said, if it hadn't been for this place, where would I be?
At Catherine's, we're on the front lines of dealing with the obesity epidemic in the United States and all of the chronic disabilities that follow it. And Cynthia is a great example of someone who we were able to empower. She came to us as a caregiver. So many of our patients at Catherine's have disabilities and health problems, and they're caring for several other people that are even more broken. She's taking care of her husband, who's a Vietnam vet, who still suffers from that experience. And she felt trapped in her body, but also trapped in her mind.
Life pretty much beat me up. That's what I felt like when I was caregiving for him, and yet I'm having my own issues. I'm having my own problems with my own body. And before I met Catherine's, I felt like there was no way for me to go, that I had no insurance and that I was poor and not worth a whole lot, that there just wasn't a real reason for me to be here, even as the caregiver of my husband, because there just wasn't any help for me. There was no, every time I turned a corner, I checked something out, I asked for help. There was no help unless I could afford it, unless I could turn over money for it. And there wasn't money. And the more that I felt, the more that I hit those walls, the more that I felt like I was worthless. There was no worth to me. And so I lost myself a whole bunch. When I came in here, I was totally lost. There was nothing there of me. And the people here encouraged me. This person looked at me, this staff person looked at me in my face and my eyes and made me believe that there was worth and value and dignity in me. And then took me by the hand to make choices more healthy for me. No one put me down here. They all asked, how can we help? And they held their hands out for me and took my hand and helped me to dig myself out of the hole that I felt like I was in at the time.